Ramesh, and today we'll be discussing brain herniation, a potentially fatal neurological emergency caused by elevated intracranial pressure, or ICP. If left untreated, it can lead to irreversible brain damage or even death. As healthcare professionals, it's very crucial to understand its causes, symptoms, diagnosis, and the different treatments to improve the patient outcomes. Brain herniation occurs when elevated intracranial pressure forces the brain tissue to shift, compressing parts of the skull. This displacement can severely damage vital areas, including blood vessels and the brainstem. There are four main types of herniation: uncal, tonsillar, subfalcine, and central, each involving different parts of the brain. Let's break each one of these down. Uncal herniation happens when the medial temporal lobe moves to the notch, compressing the midbrain and cranial nerve. Tonsillar herniation involves the cerebral tonsils descending to the forearm magnum, putting pressure on the medulla. Subfalcine herniation pushes the cingulate gyrus under the falx cerebri, compressing the anterior cerebral artery. Lastly, central herniation involves the downward movement of the diencephalon and midbrain through the tentorial notch. Several conditions can lead to brain herniation by increasing intracranial pressure. Traumatic brain injury, such as from car accidents or falls, is a very common cause. Brain tumors may also cause mass effects and surrounding edema, while hemorrhagic strokes and hydrocephalus can disrupt normal brain and fluid balance. Brain infections like abscesses or encephalitis also increase ICP and elevate the risk of herniation. The early symptoms of brain herniation include headache, nausea, vomiting, and confusion. As herniation progresses, neurological signs such as unequal pupils, slurred speech, and seizures may also occur. Severe signs include abnormal posturing, coma, and Cushing's triad, which consists of high blood pressure, slow heart rate, and irregular breathing patterns. To diagnose brain herniation, we rely on imaging studies like CT scans or MRIs to help detect the mass effects that shifts in the brain structures. Neurological exams, including pupillary light reflex tests and the Glasgow Coma Scale, helps assess the consciousness levels. In some cases, ICP monitoring via an intraventricular catheter may be necessary to track pressure changes in real time. Treatments focus on reducing intracranial pressure and preventing further brain damage. Medical management includes osmotic diuretics and mannitol and hypertonic saline. Respiratory support via mechanical ventilation helps control CO2 levels as well. In severe cases, surgical interventions such as craniectomy or tumor removal may be required. Prevention involves prompt treatment and head trauma, infections, and brain tumors as well. Certain groups are more at risk of brain herniation. Approximately 65% of severe traumatic brain injuries lead to herniation. Elderly individuals face a threefold increased risk, mainly due to falls and the use of anticoagulants. Around 15% of brain tumors may cause herniation. Additionally, regions with limited neurosurgical care often see higher mortality rates. The process of brain herniation begins with increased intracranial pressure, usually from mass lesions, edema, or excess cerebrospinal fluid. This forces brain tissue to shift from higher to lower pressure regions, compressing blood vessels and restricting blood flow. If untreated, this compression can lead to ischemia, brain stem damage, and neuronal death. If left untreated, brain herniation can result in severe complications like brain death, respiratory arrest, and neurological deficits. Cardiovascular collapse can also occur due to dysregulation of autonomic functions. Timely recognition and intervention are also crucial, as even with treatment, patients may experience long-term disabilities. After a brain herniation, or for those at risk, certain lifestyle changes are essential. Regular medical follow-ups are critical to detect rising intracranial pressure, particularly for individuals with hydrocephalus, brain tumors, or a history of head trauma. Activity modifications such as avoiding heavy lifting and strenuous exertion can also prevent further complications. It's also important to seek immediate medical attention after any head injury, no matter how minor it is. Brain herniation is a very serious and potentially fatal condition that requires immediate recognition and intervention. By understanding its causes, symptoms, and treatment options, healthcare professionals can make a significant difference in the different patient outcomes. Early diagnosis, aggressive management, and prevention strategies are key to saving lives and minimizing long-term damage.